You wanted a crash course on women in medicine.
And let me tell you, we are ready to deliver.
We really dug deep on this one.
Sure.
We've got a YouTube video on the big medical discoveries through the years. We've got these interviews with female doctors right here in Canada, and even a whole project someone put together on influential women throughout medical history.
Yeah, it's fascinating to see it all together.
Yeah.
Because you start to realize how much is often missed when you just focus on one side of the story.
Totally. Like even our first source, the YouTube video, it's like this whirlwind tour of medical marvels.
Right.
You've got Edward Jenner and the smallpox vaccine, Alexander Fleming just stumbling upon penicillin. It's all the names we remember from textbooks. But it's interesting who those textbooks tend to focus on.
Yeah, and I think this video, like a lot of historical accounts, really centers on these male figures. And it's easy to just sort of accept that. But it makes you wonder, what other stories are we missing?
Exactly. And that's where these other sources come in. We were struck by this CTV segment with these female doctors talking about their experiences. And honestly, it was kind of disheartening. It made us realize, do you know nearly half of the doctors in Canada right now are women?
Yeah, it's actually quite remarkable how much that's changed even in recent decades.
Right. You'd think that would mean things are pretty equal. But that's not always the case. These doctors shared stories about facing disbelief, being mistaken for nurses, having their expertise questioned, all while wearing their scrubs and stethoscopes.
It's like, ooh, we have these unconscious biases, even in a field like medicine where you think expertise be the most important thing.
Right. One even talked about how a nurse told her she had to wait for the physician to approve a medication. She was the physician. I mean, it's almost funny, except it's happening way too often to be a joke.
Yeah, and it really points to these larger systemic issues. Our sources highlight things like, unequal pay, fewer mentorship opportunities for women, and even biased evaluations that can really hold them back in their careers.
It's like we're celebrating these amazing medical discoveries on one hand, but on the other hand, you have this huge chunk of the medical workforce facing these ridiculous barriers. Like we're missing half the story. And that's what I really like about this document on women in medicine. It highlights some incredible women who not only made major contributions, but also really had to fight to be heard.
It's like their stories just don't get told enough,
Right, like we kind of glossed over them.
Yeah.
So let's talk about some of these pioneers. This document on women in medicine, it actually starts with someone I bet you've heard of, Florence Nightingale. And I'll admit, I kind of had this image of her in my head, just this really kind nurse.
Right.
But she was so much more than that.
Oh, absolutely. I mean, before Nightingale, hospitals were often these overcrowded, unsanitary, just dangerous places.
It's scary to think about.
Yeah. And she basically proved during the Crimean War that just basic hygiene could drastically cut down on deaths.
Wow.
Like hand washing.
It's crazy to think that something we take for granted now was like a revolutionary idea back then.
Yeah.
But because of her work, hospitals transformed from these places where you might actually go to die to places of actual healing.
Yeah, and it's amazing how much of her influence you still see today. Think about modern nursing practices. A lot of that goes right back to Nightingale.
Wow.
She really changed how we think about patient care. It makes you think, how many other brilliant minds might be lost to history just because of when they lived.
It's like we just don't even know what we're missing.
Exactly.
Yeah. And speaking of brilliant minds, we can't talk about women in medicine without mentioning Marie Curie.
Yeah.
Radioactivity. Cancer treatments. 2 Nobel Prizes.
A legend.
Right.
Yeah. Her dedication to her research is just incredible, especially when you consider the challenges she faced as a woman in science.
Yeah, absolutely.
But her work with radioactivity, it wasn't just about physics. It opened up this whole new way to think about treating cancer. I mean, think about therapies like radiotherapy, still used today. That goes back to Curie's work.
It's mind-blowing.
It really is.
So many people alive today owe their lives to her discoveries. It's incredible. And our research actually highlighted another name that I have to admit I wasn't that familiar with, Virginia Apgar.
Oh, yeah.
Have you heard of the Apgar score?
Of course. It's used in delivery rooms all over the world to assess newborns right after they're born.
Okay, see, I had no idea.
Yeah, it's this really quick way to get a sense of the baby's health, make sure they're getting the care they need right away.
And that system was developed by her.
Yeah, by Virginia Apgar. Decades ago.
And it's still making such a difference today. Talk about a lasting legacy. Wow. But here's the thing that really struck me. As we were reading about all these amazing women, None of them had it easy. Like, they were constantly pushing boundaries, battling societal norms, and often working in these male-dominated spaces with very little support.
That's exactly it. It really highlights how much resilience it took for these women to break into these fields and the determination.
That's incredible.
You know, it makes you wonder what they could have accomplished with even like half the support and resources that their male counterparts probably had.
For sure. Right. It's like their achievements are incredible on their own.
Yeah.
But when you consider the obstacles,
Yeah.
it's even more impressive.
Absolutely.
They weren't just brilliant minds, they were trailblazers, paving the way for future generations of female scientists and physicians, which kind of leads to the question of what's next? Where do we go from here?
Yeah.
It's like, how do we even begin to tackle this?
Yeah.
Because we've come so far, but we're obviously not there yet.
Well, I think acknowledging the problem is a good start,
Right.
like we're doing right now. You know, just saying, hey, this isn't okay. We can't fix what we don't acknowledge.
Right.
But beyond that, it has to be about action.
Yeah, for sure.
Like, what if? What if medical schools and institutions really took a hard look at how they evaluate people?
Okay.
Like, really dig deep to see if there's any unconscious bias creeping into those evaluations and holding women back?
Yeah, that makes sense. And you mentioned mentorship earlier. What if there were more opportunities specifically for women to mentor other women in the field?
Well, absolutely. That kind of support can be invaluable. And we can't forget about leadership roles.
Oh, yeah, true.
Imagine if we had more female deans of medical schools, more women leading departments in hospitals.
Right.
That would send such a powerful message
Yeah, it would.
that women are not only capable, but deserving of those positions.
You know what it makes you think about, too? All the little things. Like, when I hear the word doctor, do I automatically picture a man?
That's interesting, isn't it?
Do I question a female doctor more than I would a male doctor?
Right.
Or dismiss her expertise without even realizing I'm doing it?
It's definitely something to be mindful of.
Yeah, we all have a responsibility to check ourselves for that.
Absolutely.
And I love what you said about amplifying women's voices, like really listening to their experiences in medicine and believing them.
It's so important because for so long, those stories were silenced or brushed aside. We need to create a culture where women feel heard, respected, and valued.
Because ultimately, this isn't just about fairness.
Right.
It's about better healthcare for everybody. Because if we have more diversity of thought, more diversity of experience in medicine,
Exactly.
that's going to lead to more innovative solutions, more comprehensive research, a deeper understanding of how to care for all patients.
A more inclusive medical field benefits everyone. It leads to better treatments, better care, and ultimately a healthier future for all of us.
That is the perfect note to end on. We covered so much ground in this deep dive, from celebrating these amazing women who really shaped medicine to confronting the challenges that women in the field still face today. And I think you hit the nail on the head. It's complex. But if there's one thing I want our listeners to take away from this, it's that sense of curiosity, that desire to keep learning, keep asking questions. What other stories are out there? How can you be an ally for gender equality in healthcare? Keep the conversation going, and let's see what we can achieve together.